Kaushik De. Kaushik De, please say something. Unmute, please. Unmute, Kaushik De.
Sir, please unmute yourself. Kaushik De, sir, please unmute yourself.
Yeah.
Yes.
Actually, my connection was disturbed.
Very weak.
I cannot see cannot see now.
Okay, no issues. Arindam, please say something. Arindam, Arindam said, our state secretary, please say something.
I cordially welcome Madam Karthika Madam for our sixth webinar of the IIP West Bengal branch and IIP Women's Cell of West Bengal. I will cordially welcome you, and I'm really thankful to you giving time to us for such a nice webinar coming. And I will also welcome all the viewers of this webinar. And lastly, I am really thankful to the IP technical team to giving such a nice support to us. Thank you.
Now, I would like to say something. Tahmina Islam, our joint secretary. Tahmina, please say something.
I welcome you all to the
sixth.
Is it fifth or sixth? Oh,
sixth
webinar by the West Bengal state branch along with the Women's Cell. So it's a great effort. So we hope we have been conducting these webinars quite well, and more than 100 webinars have been conducted by the Indian Association of Physiotherapists. So congratulations to the Indian Association of Physiotherapists for that. And at the same time, all the thanks to the IP technical team also for doing it quite successfully till now. And we have more such webinars, such knowledgeable webinars to come ahead, I'm sure for that. And welcome, Ms. Karthika. So hope it would be a great insight for us. Very interesting topic, diet and nutrition to speed up the injury recovery. Very interesting topic, and hope all the viewers would experience a new insight to the treatment protocol, especially the physiotherapists and the nutrition. In terms of nutrition, we know very less. So how it speeds up the recovery along with physiotherapy, it would be a great insight for all the viewers. So welcome you all. Welcome, ma'am. And with that, I'll hand it over to Kaushik, please.
Thank you, ma'am. Now I would like to say something. Tanushree Bhattacharya, who is the head of West Bengal Women's Cell. Tanushree, please say something.
Yeah. Hello, ma'am. Welcome, all of you, all the delegates, and it is very nice to have you here in this forum. And I will be welcoming you and like to introduce little bit of your specialty to all of our members. So, our today's resource person is Karthika Thirugnanam, ma'am. And let me tell
the tough name.
Oh, sorry.
No worries, no worries.
Let me tell something about our resource person. She is our well-known registered dietitian and nutritionist registered under USA Commission on Diabetic Registration. She is an expert in supporting diseases reversal in conditions such as diabetes mellitus, chronic inflammatory diseases, heart diseases, and metabolic syndrome, and so on. There are lot of things to say about you, but we have a very few time and we don't have much time to tell. And last but not the least, she also serves as a nutritionist and dietetic expert for Volsky online magazine. Hope, ma'am, you can start with our topic and it will be most successful in our webinars.
Thank you, Tanushree. Thank you. Karthika, ma'am, please, you can start.
Thank you. Thank you so much for the wonderful introduction. Thank you, Indian Association of Physiotherapists and Dr. Sanjay Sarkar for introducing me to all of you. Thank you to all my fellow colleagues. It's a little intimidating, one dietitian with so many physiotherapists, but I'll try my best and hope to give you guys some insight. Thank you to all the friends and family, everybody who's joining us today. And I'm just gonna start sharing my PowerPoint presentation now, if that's okay. All right. Is everybody able to see the PowerPoint?
Yes, ma'am.
Okay, perfect. So my name is Karthika Thirugnanam. I am a clinical nutritionist, dietitian. I currently work for a private practice called Tucker Medical, and my interest, passion is really, personalized health. And so, today we're specifically talking about injury recovery. So, I hope to kind of discuss some of the broader aspects of injury recovery and how nutrition can be one tool to speed up the recovery. Of course, physio is a big one. There's also pharmaceutical and medications that will be involved, and nutrition is just part of that piece. So, everything I discussed today is, will provide a background. It's not medical advice for any of the non-healthcare providers that are joining in today. It's just to give you a background of sort of how we approach nutrition for this particular cases. So at the bottom, I actually have some of my social media information. I'll put it up again towards the end of the presentation. So if you have any questions or you need the slides or you need resources, you can always reach out to me after this session. All right, so coming up, I'm going to talk a little bit about injury, the broad categories of injury, acute and chronic injury. And then I'm going to talk about the different stages of recovery from injury as well. Following that, I will be defining nutrition. So nutrition is a tool that you can use to help recover from injury, but we need like a broad picture of what nutrition is, and then we'll sort of go a little narrow into how we're going to apply that. And then I will be talking about nutrition for each of those stages of recovery, and meal and supplement options, practically how we're going to apply some of those things into some of our patients or even personally. All right. So acute injury. Acute injury is literally things like sprains, things like soft tissue strains, things like bone fractures. So literally if you see someone running and they have a fall and they have a fracture or they have a sprain, anything that injures tissue, muscle, these are all acute injuries. And they tend to benefit the most from nutrition intervention right at that moment if we intervene at the right time. Now, if we look at some of the chronic injuries, on the other hand, it does tend to be a little bit more overuse related injuries. So now if you look at someone like the person in my picture down here, it is an older male, and chronic injuries can sort of present themselves in many different ways. It can be stabbing pain, sharp pain, throbbing pain, aching, tightness, and things like that. They do tend to sometimes occur if an acute injury is not dealt with in an appropriate manner. It can also happen through chronically undealt with issues such as, walking position, muscle imbalances, improper footwear, and things like that. And so these are kind of habitual. So people actually don't feel it immediately, and they're less likely to intervene with nutrition with chronic injury, because like chronic diseases, chronic injury just doesn't happen overnight. It does tend to build up over time. So the purpose of today's presentation, I'm actually going to be focusing more on the acute injury aspect. So injury recovery, how does it work? So first step, someone falls down. The first thing that happens is inflammation, right? Inflammation is a natural process that occurs in the body, although it sounds scary, and I have it in red font. The area becomes red, painful, hot, and swollen sometimes. So that is that first step of injury process and recovery. And then the healing chemicals are then attracted to that area where that injury actually occurred. So if you think about it, although inflammation sounds like a negative thing, it's actually a positive thing. It's part of that process that the body uses to heal. The second stage is actually proliferation, which is basically when the damaged tissues are removed. So anything that's dead, anything that's injured over there, that's basically, kind of when the scabs form and things like that. That's basically proliferation stage. And this is where the new blood supply comes in and the new tissue is actually built on top of that injured area. And then the third stage is going to be remodeling. So this is basically when you're recovered and you're almost becoming a new version of that area where the injury occurred. So just like stronger, more permanent tissue that replaces those temporary tissues, kind of like scab tissues that came in to sort of do damage control in stage 2. Now, what we are going to do right now is ask a very quick question. It's a poll question. In terms of nutrition, they are categorized into macro and micronutrients. So which of the following are macronutrients? I'm just going to give you guys maybe a minute or two just to sort of answer this question. You guys can submit the questions through the Q&A or through the chat box. And let me see this. So I've got fat. Fat seems to be the most popular answer so far. Fat, zinc, calcium. I've got a few calciums. Fat. Excellent. So most of you got it right. Fat. Fat is one of the big macronutrients. And so having said that, macronutrients. There are 3 macronutrients that everybody uses. And the first one is going to be carbohydrates. Now, carbohydrates are generally referred to as the quick source of energy. So, I mean, if you deal with a lot of athletes, a lot of them drink sports drinks and, something like a lot of these energy drinks, they tend to be, heavy in sugar content. And basically sugar is a form of carbohydrate, and that's why they feel that quick sense of, I can go, right? It used to be referred to as the primary source of energy, but more and more research has shown us that there are ways to manipulate your body to use fat as a primary source of energy as well. That's a topic for another day. And carbohydrates generally break down into glucose. So if you think about carbohydrates, you're thinking about things like rice and bread and roti and things like, and biscuits and things like that. They all break down into glucose except fiber. So fiber in general does not break down into glucose. It's a form of carbohydrate, but it's mainly used in the gut for, feeding the gut bacteria and for bowel movements, okay? So essentially carbohydrates break down into glucose, all carbohydrates except fiber. The next one is protein. Now, protein is essentially called the building blocks of the body. Pretty much your muscles, your hormones, and all of these things are built using protein. They are generally not used for energy. That's why, a lot of athletes, they tend to consume the protein after exercise because there's a lot of muscle damage going on through exercise. And so they consume the protein to kind of rehabilitate some of that. Protein breaks down into amino acids. Or if you look at the reverse, protein is actually a combination of amino acids that form a protein unit. And so protein, essentially that's what it is. It's the building block for bodies, and it can be used for energy, but it generally is not used for energy unless you don't have sufficient amounts of carbohydrates. Fat. Now, fat is generally referred to as the insulator. Some people will joke about the fact that, I have a lot of extra fat lying around. It is generally the stored form of energy. So whenever you consume food, anything that is unused is generally going to be put away as fat. So whenever people tell me like, Karthika, I want to lose weight, I'm like, you want to lose weight? I can chop off an arm and you can lose weight. What you really want to lose is fat mass, right? Because that's that stored energy that's just never being used. So yeah, it's the stored source of energy. So in the event that you don't use as much carbohydrate, you are then going to use fat. So you can sort of look at it as a backup source of energy. And fats are generally broken down into fatty acids. So broad picture of nutrition, just want to give you an overview before we can sort of look at how each of these are gonna essentially play a role in each stage of that recovery. All right, so next part, we talked about macronutrients. Those are essentially the things that we consume in large amounts and affect metabolic health and big picture. And now we're looking at micronutrients. Now, micronutrients are also further categorized into two groups, vitamins and minerals. So when I became a dietitian, I thought I was going to study about food. And somehow all my patients were actually focused on, what supplement can you give me to help me lose weight? What supplement can you give me to help me recover, right? And unfortunately, when people hear vitamins and minerals, they always think of pills, because a lot of us, end up consuming them in the pill form. But micronutrients are actually mainly found from food. And everything that contains macronutrients contain micronutrients. So vitamins are then further categorized into fat-soluble vitamins, vitamins A, D, E, and K, and water-soluble vitamins. So that's going to be vitamin B and C. Now, the key point to remember about these two categories is that fat-soluble vitamins, they tend to be absorbed by the body through fat. So, if someone's not consuming enough fat, they're going to have trouble absorbing the vitamin A, D, E, and K. They are also the ones that you want to be very mindful of consuming excessive amounts of. So if any of your patients are telling you they're taking supplements, it's a good idea to look at the label and look at the percentage of fat-soluble vitamins. So they'll actually say like 100% of recommended intake, or 300%, or 500%. So A, D, E, and K, you always want to make sure that it's not, much higher than 100%, because it can bioaccumulate in the body fat. Water-soluble vitamins. So a lot of times athletes do take B complex vitamins, to give them energy and things like that. B vitamins and vitamin C are common, basically water-soluble vitamins. And these are not as dangerous. Water-soluble vitamins, actually, even if you have a little bit extra, you can actually urinate it out. So vitamin B, B12, folate, and thiamine and things like that, these are all different forms of B vitamins. Even if people have a little bit extra, they're fine. They're just gonna have really expensive urine, and so it's not as problematic. And that is the same with vitamin C. Now, vitamin C is getting a lot of press because of COVID-19. So you are gonna be getting a lot of patients that are telling you, oh, doctor, I'm taking vitamin C, and generally not much of a concern if they're taking extra amounts, but if they're taking super doses, that can cause things like diarrhea and things like that. So again, another vitamin that you want to kind of watch out for, but generally not as harmful. Now, minerals. Minerals are also categorized into two different groups. Minerals can be categorized into macro minerals and trace minerals. So macro minerals are going to be things like your sodium, potassium, calcium, magnesium. Kind of the same concept of macro and micronutrients. Macro minerals are consumed in larger amounts. So, if we look at a daily recommended intake for sodium, we generally say about 2,300 milligrams, right? And potassium is about 2,500 to 3,000 milligrams, right? Whereas if you talk about things like iron and zinc and selenium, we like iron for like a reproductive female who generally requires the most amount of iron, she'll need about 18 milligrams. So you can sort of see the difference, right? Like sodium, you need like 2,300, whereas iron is like 18. So that's essentially, the reason behind the different names, in terms of macro minerals and then trace minerals. All right. So these are all things that I want to give you a background of, because I'm going to talk about how you're going to use it in different points of injury recovery. Great. So nutrition for stage one. Stage one process of that injury recovery, which is inflammation. So if you're talking about combating inflammation, naturally, you want to make sure that you're focusing on consuming foods that reduce inflammation, right? So that's sort of stage one. Stage one is reducing and managing that inflammation. A small amount of inflammation is necessary for that injury recovery process, but you obviously don't want to overdo it. And so you want to use nutrition as an excellent tool to reduce some of that inflammation. So that redness and that swelling from that stage one. Now, anti-inflammatory foods. So the first group of anti-inflammatory foods are going to be berries, which are a little bit harder to get in the Asian region, but they do contain a lot of anti-inflammatory, antioxidant properties. So if you are able to find some strawberries or blueberries, these are excellent snack options that people can eat when they are in that acute injury phase, right? One thing that you do get in India, and we do get easily in Asia, is pomegranate. Pomegranate is an excellent source of those same antioxidants that berries give you, and they're more available in the Asian region. The other thing is dark leafy green vegetables. Leafy greens are an excellent anti-inflammatory food, and lots of studies have actually shown that higher intake of leafy green vegetables actually reduce inflammation in the body in the long term. So this is something that people can actually consume on a daily basis to also combat chronic injuries, chronic inflammation and things like that. So it's something very simple. And a lot of people, what ends up happening is they do eat leafy greens, but they're not eating enough. So it's important that we're eating at least, about 1 cup of leafy greens during that period of time when people do have that acute inflammation process. The other thing that a lot of research is going into that's showing up for anti-inflammatory properties is omega-3 fatty acids. It is a type of fat that's mostly found in fish. So essentially, you want to be consuming at least 2 to 3 servings of fish a week if you do eat animal products. And if you don't eat animal products, there are vegetarian sources that have omega-3 fatty acids as well. And those are going to be things like flax seeds and chia seeds. They used to be a little bit harder to find in Asia, but now it's almost become commonplace. So, for fish, you want to make sure like it's 2 to 3 servings a week. And for flax seeds and chia seeds, it's anywhere between 1 to 2 tablespoons, most days of the week. So omega-3 fatty acids, excellent anti-inflammatory foods that you can include during that acute injury phase to sort of help that inflammation. The third one is actually going to be avocados, nuts, and olive oil. So these are essentially sources of monounsaturated fatty acids, and they are also being linked to a lot of anti-inflammatory properties. And they also reduce overall inflammation in the body, which actually increases your risk for other things like heart disease and cancer and things like that. So everything good. And avocado, again, I was told, it is much harder to find in our region. So you don't have to go look for avocados. Olive oil is much easier to find. All of these nuts, things like walnuts and pecans and almond nuts and pistachios, these are all great sources of that same monounsaturated fatty acid. So you don't have to go looking for avocados if they're difficult to source, especially not during COVID-19. You definitely want to minimize the amount of outings. And the third one is a lot of herbs and spices. Now, turmeric, with an Indian population, I don't even need to talk about the benefits of turmeric and all of the studies that have gone on about turmeric. It's the curcumin component of turmeric has shown to have anti-inflammatory properties. And the great thing about turmeric is that it is quite easy to add into a lot of foods, and you can eat it either in the powdered form or in the raw form, which we have access to. Now, when I used to treat patients in the US, they used to have a lot of trouble getting the raw turmeric. So they used to actually eat turmeric pills. So, we are lucky in that we get the raw turmeric and you can actually eat like an inch in the morning, an inch in the evening, not a problem. And the thing with eating raw turmeric is it's very difficult for you to consume excessive amounts. Whereas when you're eating it in the form of a pill or a supplement, people sometimes can end up consuming way more than they need to. So that's kind of a safety aspect. Green tea. Green tea is also something that's very popular, and it's becoming very prevalent and easy to find these days in the grocery stores. It is an excellent anti-inflammatory food as well. And garlic. So 7 to 8 cloves of garlic. You know, it's very easy to include in your foods. It is very easily available in our markets as well. Again, you know, with a Western population, people used to eat garlic pills, and I used to be like, really, you guys are eating garlic pills? But you know, it's a thing, and we don't need to do that. We can actually include that in our foods. We can eat them raw, and it's a very easy, commonly available food that can really help when you just increase the intake a little bit during that acute phase of recovery. Now, so we talked about anti-inflammatory foods, and now we have to minimize pro-inflammatory foods. So those are the foods that can help you reduce inflammation. These are the foods that can help you prevent worsening the inflammation as well. Okay, so the first one, and there's a lot of studies showing this now, is basically your added sugar, right? A lot of research is showing that added sugar actually has a direct impact on something called C-reactive protein, which I'm sure a lot of the healthcare providers know that is a big indicator for inflammation in the body. So, you know, the first thing that like if somebody is sick, the first thing that shows up in the blood is usually the ESR, which is also a marker for inflammation, and the CRP. And studies have actually shown that for every 50 grams of sugar that's added in food, it actually dramatically increases the CRP. So added sugars are completely unnecessary for, you know, for overall living. I'm not talking about sugar that you get from your pomegranate or from your apple or from your fruits and, you know, potatoes, sweet potatoes, things like that. I am literally talking about the sugar that is added in your coffee, in your tea, in any of your cooking. At least at that point of that acute injury, minimizing the sugar as much as possible is really going to do you a lot of good. The second most pro-inflammatory food is trans fat, right? Fat is something that's, you know, that's can be very positive, as we spoke about the omega-3 fatty acids and the monounsaturated fatty acids. And now the other categories of fat are saturated fat, which sort of has a neutral effect in terms of inflammation, and trans fat that actually has a very negative effect. Now, trans fat is completely non-controversial. Everybody agrees it's bad. And trans fat is found in minimal amounts in some dairy products and red meat, but most of the trans fat in a lot of people's diet is coming from processed foods. So, you know, things that you get out of a package, you know, a lot of the junk food is essentially the source of trans fat. So a lot of your street food, your samosas, a lot of your potato chips and mixers and all of these fried snacks, they do tend to be where most of our trans fat is actually coming from. So that is something that you want to avoid at all costs. And whether or not you have an acute injury that you're trying to recover from, you definitely want to avoid these in the long run. There is generally no point in trans fat. It does not give anything positive to the body, and it is literally a byproduct of processing. It is not naturally occurring. All other 3 types of fat occur naturally, like saturated fats are found in animal foods and dairy products. Monounsaturated fats are found in nuts, seeds, avocado. Polyunsaturated fats are found in fish. These are all naturally occurring, and majority of trans fat is only a byproduct of processing. So, you know, avoid your processed and, you know, highly fried foods like your puri, luchi, your samosas and potato chips and all of these things. Definitely avoid it, at least in that acute period. and then in your overall life, definitely reduce, because I am human. I do know that these things are part of our life, but minimize. And then the last one is alcohol. Now, alcohol has sort of this unique property where it is not a carbohydrate, it is not a fat, it is not a protein. Now, carbohydrate has to be converted into glucose in your liver, right? So alcohol has to be converted, and it actually puts a huge stress on your liver. So that's one big aspect of alcohol that everybody knows. But the problem with alcohol is also the fact that it disrupts sleep. So the fact that it disrupts sleep disruption is a big pro-inflammatory issue. So poor sleep causes a lot of inflammation. So if you are recovering and you are not sleeping well because of the alcohol, that's just a very bad combination. So very important, no alcohol. And also, a lot of times, patients are taking pain medications while they're recovering from an injury. So whether it's NSAIDs or other pain medications, and the worst thing you can have is an interaction with alcohol. So definitely be mindful, when you are interacting with patients. This is something that most people probably don't discuss. Most people don't even discuss their alcoholic intake with their dietitian. They may discuss it with their doctor. So with their physiotherapist, it might not even occur to them. So a little bit of probing, you can actually prevent a lot of damage. And it can actually help their PT work a little bit better as well when they reduce that inflammation. Great. So time for another poll. Which of the 3 macronutrients is the most important for injury recovery? So again, you guys can put the answers in the chat box, and I'm gonna give you some time to sort of answer that question. Let me see what I'm getting. Water, I get a lot of water. Protein. Oops, I think I gave you the answer. Most of you got protein. I think that's a given. So yes, protein is the macronutrient that is the most important for injury recovery, clearly, because they are the building blocks of the body. So if you are destroying muscles and tissue from an injury, naturally it's the protein that's going to help you rebuild that, right? So nutrition for the stage 2 and 3, protein's going to come up now. Proliferation and remodeling. You are literally rebuilding. And so at that point, the number 1 priority is going to be energy intake. Now, this is where there's a lot of individuality. Hello.
Yes.
Okay, all right. Perfect. So as I was saying, the number 1 priority in that proliferation and remodeling stage is actually energy intake. So depending on the person's type of injury, location of injury, severity of injury, their age, their gender, we will calculate their energy requirements, the dietitian. And so when they have an injury, it will actually increase your energy requirements. So that is the number 1 priority. And depending on the injury, their energy needs can increase anywhere between 15 to 50%. So if you think about like if an average person consumes 2,000 calories a day, because of an injury, their requirements can go, to 2,300 if we're looking at 15% increase, or as much as 3,000 calories a day during that recovery phase. So that's something that we do really prioritize. And then the next thing is protein, as you guys have already answered. So the injured body parts, they often are immobilized, and this can cause a significant decline in strength and muscle, as you guys are aware of. That is why physical therapy is so important, because there's only two ways to build muscle in your body. One is through nutrition intake, that's where I come in, and the other is through exercise, right? So definitely, this is where nutrition and PT really come together, is that after that injury, we need to be providing protein literally to replenish them. And their requirements, so if you think about an average individual, the minimum protein requirement is about 0.8 grams per kilogram. That's what the recommended dietary intake is supposed to be. Now, what does that mean? So if we have an 80 kilogram person, 0.8 grams per kilogram, that's about 72 grams of protein that the person has to take in. Sorry, 64, not 72. 64 grams of protein that they have to get in. Now, when they have an injury, if 64 was their baseline, they may have to increase it to maybe 80 grams or even higher than that, maybe even more than 100 grams. But that really depends on a few things. It depends on, number one, if they're an athlete, they're probably consuming more than 0.8 grams per kilogram to begin with, right? You've taken care of athletes. Some of you may be athletes, you probably consume a higher amount. But then if in that case, increasing them to 1.5 might not be enough, because their baseline might be 1.5 grams per kilogram, right? So in that case, we may increase it to 2. But if we have a non-athlete whose requirements start at about 0.8, we may just increase it to 1 gram per kilogram or 1.2 grams per kilogram. So again, there's some individuality in that calculation for protein. Now, protein sources, right? Everybody knows where we get protein from: eggs, fish, chicken, meat. And then when we look at vegetarian sources, it's mostly going to be from your nuts, seeds, beans, pulses, legumes, right? But there is a significant difference in the protein source in terms of how complete the protein is. You guys may have already heard about this, that a lot of vegetarians, they can get whole proteins, but they do need to micromanage a little bit more. The bioavailability of proteins are very different between the animal sources of protein and the plant sources of protein. So we're going to talk a little bit more about some of your patients who may be plant-based eaters. Basically, as I discussed previously, proteins are a combination of amino acids, right? And the combination of amino acids that we need to consume, 9 of them are essential amino acids. Basically, our body cannot produce them. The rest of them, they can be produced by using the essential amino acids. Now, the essential amino acids have to be consumed because they cannot be produced. And many plant sources either do not have one or more of the essential amino acids, or they have very low amounts. So an example of that would be something like beans, right? So beans actually have a high amount of lysine, which is a type of amino acid, whereas it's low in methionine. Now, if you look at something like rice or even roti, like wheat, that tends to be very low in lysine and higher in methionine. So when a person who's vegetarian combines that roti with the bean, or combines that rice, with the beans, they actually end up forming a complete protein, right? So that's how you can use combination foods to get that complete protein for your vegetarian patients. There are some complete proteins that are completely plant-based as well, and those are going to be things like chia seeds, things like edamame, and tofu. So again, tofu is something that's it's a bit of an acquired taste. Chia seeds are also a little bit newer. They're more of a South American based seed, and they are becoming more prevalent now. But again, excellent source of complete protein if you can find it. You can easily add 1 to 2 tablespoons in cooking. Sometimes, you know, my mom likes to put it in her water. It just soaks up. It's chewy and crunchy. It forms like a gel-like substance, and it can also be used to make pudding and things like that. You can make dessert with chia seeds, and so it's quite a versatile ingredient. And so yeah, that's sort of a complete protein as well. So this is something that you want to be mindful of. So you may have plant-based patients who are vegetarian. They're like, yeah, I get a lot of protein. I eat a lot of dal. But the reality is, if you look at one serving of animal protein, if you think about something like a piece of chicken, it has anywhere between 20 to 25 grams of protein. And if you look at a half a cup of something like chana, it's got about 8 to 9 grams of protein. So the protein concentration in vegetarian sources that traditionally is consumed by Indian patients, it's not sufficient. So these are people who may actually require protein supplementation, right? The vegetarian sources that are a little bit more concentrated with protein are things like tofu. So these are all things that if you find that a patient needs it, they might be a good person to refer out to a dietitian so that they can ensure that they're getting enough protein. If your patient is a meat eater, then it's less difficult for them to meet those protein requirements, and they may not need that supplementation. Right. Now, vitamin C. So vitamin C, as much as it's being spoken about for immune function and all of those things, it's more because of its antioxidant properties. Vitamin C is heavily involved in the process of collagen formation. And you guys already know that collagen is a big part of maintaining the integrity of bone, muscles, and tendons. So vitamin C is part of that formation of collagen. So getting sufficient amounts of vitamin C is key in that stage 2 and 3 proliferation and remodeling phase. Now, how much vitamin C? So daily requirements of vitamin C is anywhere between 80 to 105 milligrams. Not hard to get. You get vitamin C from leafy green vegetables, the very common source of vitamin C, oranges, lemons, broccoli, things like that. Very easy to get. But, you know, people do benefit from a little bit extra, so they can eat a little bit more leafy greens, maybe eat an extra kiwi, and they can make up for that. Generally, people do not need to supplement it unless their injury is very severe. And even if they do supplement, as we discussed in the slide that we talked about micronutrients, it's not harmful as long as they don't exceed like 500 milligrams a day. Vitamin C supplementation is not dangerous. But then if you think about, you know, vitamin C in food, it's just so easily available in so many foods. It's almost a waste of money to purchase a supplement. And a lot of times companies do tend to have to use thickeners and other additives when they do make the supplement. And then you don't know what the bioavailability of that supplement is. So, you know, I'm always an advocate for anything that you can get from food, try and get it from food. But I'm not against supplements if someone has a true justification on why they're taking it. I'll be perfectly fine if my patient's saying, I'm recovering, I want to take this vitamin C for this 3-week period when I am recovering. And that's fine, you know, because clearly you have a purpose for it. Any supplementation needs to have a purpose for it. Great. So the next one is zinc. Now, zinc, similar to vitamin C, is also involved in that collagen formation, but it's also a component of many enzymes and proteins in our body. So zinc in itself, it's the deficiency that tends to be the problem, especially with older patients. So if someone has a zinc deficiency, wound healing can be delayed for them. Tissue repair and growth can be delayed for them. So, so that's the problem with, you know, having low levels of zinc. And again, with zinc, very easy to get from foods for someone who is eating animal foods, because zinc is easily available in meat and shellfish and things like that. Now, meat is also available in nuts and seeds and legumes, things that plant-based people eat. But it is not as bioavailable, And a lot of times a good way to make that zinc more easily available is by soaking it. So most of us, we don't make things like chana and rajma without soaking it, but soaking it for at least 6 to 8 hours is actually gonna open up and make the zinc more absorbable. So that is a key element that people need to think about when they say, oh, I'm getting my zinc from my beans and nuts and things like that, but making sure that that they're soaking it and then they're cooking it, and so they're actually truly getting that zinc. Now, there's also a little bit of difficulty in supplementing zinc, mainly because zinc supplementation can be dangerous in someone who does not have a deficiency. So you do not want to empirically take zinc saying that, oh, I want my wound to heal quicker, unless you have a deficiency, because excess zinc can actually affect copper absorption and sometimes iron absorption. So you don't want to, in the process of solving one issue, cause another issue. So that's a very important thing with zinc. In terms of daily needs, zinc is only about 8 to like 11 milligrams, depending on your male, female age and things like that. And when in some cases in our older patients, when they have pressure ulcers and things like that, sometimes we do supplement anywhere between 40 to 50 milligrams of zinc, again, during that short course of injury recovery, and then we generally tend to stop. We are very mindful of extended periods of zinc supplementation, especially in someone who doesn't have a deficiency. So it's a simple blood test. You could, your patient, if they truly want to take that supplement and they truly believe in it, they can always do a blood test, and then if they have a deficiency, they can take it for a short period of time. With zinc, I am a little bit more open to getting it from a supplement, especially for someone who's vegetarian, because if they are not following proper practices, there is a good chance that they're already deficient. So it's kind of a probability game. So they may actually be okay to take it, but again, for a short period of time. All right. So to sum all of this up, the main thing is in the first stage, we are talking about reducing inflammation. So we can look at foods that have that function to reduce that inflammation, and we can look at foods that actually cause more inflammation and prevent, consuming those things, right? And then in the second phase, we focus on things like increasing protein and certain micronutrients. Now, you may ask, what about carbohydrates and fats in the second phase? The main thing that you want to focus on with the carbohydrates and fats in that second phase is what you do not want to eat. So you do not want to eat trans fats, no processed foods. You do not want to be consuming refined carbohydrates, right? So things like white rice, even though it's not white sugar, it is going to break down immediately into glucose. So it's going to cause blood sugar spikes, and that is a pro-inflammation process. So in terms of carbohydrates, make sure you're getting it from complex sources that are mostly fibrous. So things like pulses, things like beans, these all contain a lot of fiber. Now, if you look at things like buckwheat, things like atta, they have a little bit more fiber. Things like oats and rye, a little bit more fiber compared to white rice. So if you are able to eat something like some of these instead, that would be good. But other than that, just consuming sufficient amounts of fat and carbohydrate, you can just keep that stable, whereas you will probably need to increase the protein. And then in terms of micronutrients, as I said, the main ones that help is, are vitamin C and zinc. There is a little bit of research coming out about iron. There's a little bit of research coming out about vitamin D and calcium, more around, bone strength and immunity and things like that, but not significant amounts of it. And then always remember, whether you are going to consume a supplement or a medication or an herb, you know, which is very common. You know, people tell you like, eat this, it's good to reduce your pain, eat that, it's good for sleep. Always make sure to verify the content of that information and ask yourself why. Why am I taking this? Am I taking this vitamin C because my friend told me? Or am I taking it because vitamin C helps with collagen production, and so I have an injury and I want my body to produce more collagen, right? Why am I taking vitamin D? Am I taking it because my son told me to take it, or am I taking it because I have weak bones, I am a postmenopausal woman, and I need to build more bones, and vitamin D is a big part of it, and so I'm taking it. Always question why you're taking a certain supplement. Always question, am I able to get it from food realistically? Because in certain large amounts, you may not be able to get it from food for that short periods of time. So maybe a supplement is warranted. So always ask those questions before you make an intervention. Purposeful interventions are the ones that are actually truly going to help, help you see the benefit. And that's essentially what I would like to sum up this entire discussion with. Stay healthy, keep moving around during COVID, especially. Try to get some sun. I know there's a lot of sort of restrictions in movement, but keeping yourself active is the best way to prevent injury, both chronic and acute. Ensuring that, as physiotherapists know, ensuring that whatever your walking and exercise practices are proper ones, right? Whether it's running posture or footwear and things like that, those things need to be verified, and that's how you're going to prevent that injury and stay happy. That's a big holistic part of recovery, because when people are not happy, they're making poor food choices. That connection between mood and food, it's too direct to ignore. So when you're happier, you make better choices. When you make better choices, you recover better. So having said that, I would like to wrap up this little conversation that we had about nutrition and how you can use it to sort of help with injury recovery. And these are some resources that I'll be happy to share with you. You can always reach out to me either via my Instagram account, or you can direct message me via Twitter, or you could get my email address from the organizers, and I'll be more than happy to answer any specific questions. My practice, we do telemedicine, Zoom consultations all the time. And so, I'm always open to having these discussions. And also, if you find any new products that are out there, supplements, any new research on recovery, I'll be happy to cross-verify. I'll be happy to read through them and sort of look at how it can fit into your life. So let me know how I can help you and reach out to me. I can answer some questions now, Kaushika, if you wanted to sort of ask them to me.
Yes, ma'am. Yes, ma'am.
Mm-hmm.
Ma'am, can we take the question, please?
Sure.
Yeah. Which food products can help increase iron in vegetarian pregnant lady in third trimester?
Excellent question. This is an excellent question and a very important one as well. So the same way we talked about zinc, iron is also not as bioavailable in vegetarian forms. So the main things that you want to look at is things like nuts and seeds and leafy green vegetables. But iron absorption is highly controlled by vitamin C. So iron and vitamin C go hand in hand. So it's not only you increasing iron intake, you also need to increase vitamin C intake. So an example of that would be, if let's say you're having rajma or chana, which is a good source of iron, is maybe adding a squeeze of lemon to it or preparing it with tomatoes in it, because these are things that have vitamin C in them, right? And so combining those foods with iron and vitamin C is going to help you absorb whatever iron is in that vegetarian source a lot quicker. So, you know, that's what the individual needs to focus on. She needs to focus on getting nuts, you know, things like badam. She needs to focus on getting pulses and legumes on a daily basis. She needs to focus on eating dark leafy green vegetables also as regularly as she can, and that's gonna help her actually get more iron in. And with iron, you can only absorb a certain amount of iron in one sitting. So you know, you don't want to be like, oh, I'm gonna eat all my beans and all my leafy green vegetables in one meal, and then I'm not gonna eat it in the other meals. No, it's a good idea for you to get some at breakfast, get some at lunch, get some at dinner, so you actually facilitate that absorption. I hope that answers the question. And congratulations to that person to be in a third trimester.
Thank you, ma'am. Next question. In diabetic injured patient, a second stage of inflammation, what will be our nutrition for the faster recovery?
So for someone with diabetes, the biggest element is going to be sugar control. They need to get their blood sugars under control. The best way is reduction of carbohydrate to as low levels as possible and increasing protein and fat intake. Because in fact, for anybody with type 2 diabetes, I will encourage them to do like continuous monitoring of their sugar and trying to make sure they're consuming foods that don't cause sugar spikes, right? So for someone who has type 2 diabetes, that's the age-old problem, is wound healing is delayed because of that sugar, because sugar is, you know, that elevated sugar increases your inflammation. So the main thing that they need to focus on is just like reducing carbohydrates significantly. And contrary to popular belief, carbohydrate is not an essential macronutrient. So you can actually significantly reduce it and you'll be fine as long as you're adjusting your medications accordingly. Because a lot of people, you know, they're eating certain diabetes medications that can bring their blood sugar low. So that's why I actually encourage continuous glucose monitoring, which is available in India. I think Abbott is one of the companies that has like a glucose meter. It's called Freestyle Libre. I'm not sponsored by Abbott. I don't have any connections to them. It's just a device that I've used before. Dexcom is another one that you can use. Continuous glucose monitoring is the key to keep your blood sugar low, keep it low, and you're gonna be able to speed up the injury recovery process.
Thank you, ma'am.
You're welcome.
Next question. How to get magnesium in daily diet through food?
So an excellent source of magnesium is going to be things like banana. It's going to be things like potato. Shellfish is also a good source of magnesium. So magnesium is actually one of those that is actually more available in plant foods than animal foods. So yeah, quite easy to get magnesium.
Thank you. Thank you. So
No
much
problem.
thank yous. Next question. Any supplement help for depression? Please suggest a name.
So the thing with depression is, even though there isn't a specific supplement that helps with depression, 90% of our body's serotonin, which is the neurotransmitter that controls mood, is actually produced in our gut, in our digestive system, right? So you want to be eating foods that actually keep your gut happy and healthy, because your gut is basically in charge of your mood, right? And so a lot of fermented foods, things like yogurt, things like dokla, things like dosa and idli, those things that are fermented. And if you look at like Western foods like kombucha and kefir and things like that, fermented foods in general are really good for your digestive system. And when your digestive system is healthy, it does help you produce, you know, more serotonin, and it's going to help depression. So that's a big one. There are some foods that specifically have mood boosting effects. There are things like dark chocolate. I mean, all the women here, you wonder why you crave chocolate a lot is because chocolate has that mood boosting effect. Coffee also has a mood boosting effect. And you just obviously don't want to be consuming it later at night because that causes sleep disruption and things like that. So more than a specific supplement, there are actually a lot of foods that can help boost the mood, and fermented foods in general. Just look up fermented foods and consume them in order to help cope with that mood changes such as depression.
Plant protein foods for the vegetarian plant protein. More, they want asking for more protein plant foods.
Yeah. So in terms of grains, a big grain that's got a complete protein source is something called quinoa. It's actually a South American grain. It's a little bit harder to find, but it is a good source of protein. Edamame and soybeans, very good source of protein. Tempeh is a very good source of protein. In fact, even paneer is a very good source of protein. A lot of people will be happy to hear that. Is an excellent source of protein for vegetarians. The only thing with paneer is that for some people who are very sensitive to that saturated fat, you obviously don't want to have excessive amounts of that. The other good source of plant protein are things like the chia seeds and flax seeds. These and basil seeds as well, which is easier to find in India, also a very good source of plant protein. So vegetarians, you have a lot of options. You just need to think a little bit more about where you get your protein, and just be mindful to make sure you include it at every meal to make up that requirement.
Sir, please unmute yourself.
Do you have any chart of food combos for better absorption?
For which specific
You
nutrient?
don't ask for any specific.
It is difficult for me to say what is better for better absorption without knowing what nutrient you're talking about. In general, I do not give out food charts. I mean, even for my patients, I think that is the hardest thing to do because most people don't eat the same food all the time. So usually what I do is I get a list of all the foods that they eat, and then I like dash out things that I want them to stop, and then I add things in. So yeah, there really isn't, as I said, my passion is personalized nutrition. What works for me doesn't work for my husband. What works for him doesn't work for his parents. It's just, we are all very individual in terms of our food preferences and just our overall body makeup. So there's no one thing that fits everybody. So I'm sorry to that person. No diet chart for nutrient absorption.
Next question, what kind of food we can suggest for patient with chronic kidney disease?
So kidney disease can be a little bit tricky. So when it Hello.
Yes,
Yeah.
audible.
Yeah, so kidney disease is a little bit tricky because it comes in different stages, right? You have stage 1, 2, 3, 4, and then you have end-stage renal disease. And the nutrient requirements are actually quite different depending on which stage you are. So until you have like complete renal failure and people who are on dialysis and things like that, with kidney disease, they do want to make sure that you're not having excessive amounts of protein. And then when you are getting dialysis, they will then say you need a lot of protein, right? So there is that element of difference. But the main thing for anybody with kidney disease that they have to be mindful of is their sodium intake and their potassium intake and their phosphorus intake. These are the three minerals that you want to be very mindful of. Requires a lot of micromanagement. So it's very difficult to give like an exact answer, but I can tell you that these are three minerals that you really have to micromanage for someone with kidney disease. And then the protein, you either will be controlling it or needing extra amounts depending on which stage of kidney disease you're in.
What vegetarian food should be taken and avoid in allergic irritation?
So for allergic, for people who have allergic tendencies, rather than saying what they can eat, the main thing that they do want to avoid is processed foods. So a lot of people who have allergic tendencies, they tend to have bad reactions to preservatives and additives and things like that. So things coming out of a package, you want to avoid. Now, when you think about foods, soy, milk, eggs, I mean, if the person is vegetarian, I don't know whether they eat eggs or not. These tend to be common allergy causing foods. So a lot of times, some of my patients, they'll eliminate dairy products. So they'll eliminate things like milk and yogurt and cheese and things like that. And they already feel better because again, dairy is one of those that sometimes people who have allergic tendencies can have negative responses to. The other food is soy. So soy can also sometimes cause a little bit more allergies for some people. So that's another one that they can try eliminating. And then the main one is definitely eating foods closer to their natural form as possible. So whenever you eat a food, you need to be able to tell where it's coming from, right? It shouldn't be like a food-like substance. You should be able to say, oh, I'm eating potato, oh, I'm eating, badam, I'm eating fish, I'm eating chicken. It shouldn't be like something that's so processed that it looks nothing like its original form. So yeah, someone with allergies, you really want to make sure that you are really focused on whole foods, and you can go on elimination diets. You can do trial and errors of taking things like dairy or taking out things like soy, even gluten. So sometimes taking out wheat can help as well. Yeah.
Okay. Next question is, which time is better to eat fruits, morning or night?
There really isn't a very good time to eat fruits. I think as it, in terms of timing of eating, a lot of studies are showing that calories overall, just food consumed around the circadian rhythm. That means during the day, we're active, we're up and about. During the night, we're meant to be sleeping, not digesting food. So in general, studies seem to indicate that people consuming food in general during the day is better. So by that definition, it is better to eat fruit earlier in the day rather than later in the day, because it is, again, a form of calories, right? But there isn't like a unique benefit in eating it first thing in the morning or last thing in the day or something like that. If somebody's telling you, ask them for the research and ask them why, right? Like what is that benefit? Because to me, I look at fruit as a source of fiber, a source of natural sugars. But other than that, there's no real pro or con in terms of eating it first thing or last thing.
Next question, with sunlight, how vitamin D will be absorbed? And in winters, how to deal with vitamin D deficiency?
Yes. So that is, vitamin D, like vitamin C, has actually become a very popular point of conversation. So, I think the person's question was essentially, how does one get vitamin D during winters, right? And during winters, unfortunately, you do need to get vitamin D from supplementation because the best source of sunlight, best source of vitamin D is going to be sunlight hitting your skin and then your body producing the vitamin D. Nowadays, a lot of companies are adding vitamin D to things like milk. You do get small amounts of vitamin D from things like egg yolks, from things like shiitake mushrooms, from things like salmon, but they're not significant amounts. So if you are someone that lives, I mean, in a region where it's winter time for a prolonged period, that period might be a good time for you to supplement some vitamin D in small amounts, because remember, vitamin D is a fat soluble vitamin, so you don't want to have excessive amounts. So yeah, it is a problem. Some doctors even think that that's why people tend to fall sick more often during winter time, because they're like, you know, people have lower vitamin D levels and that kind of compromises their immune system. It's all association studies, it's not causation, but yeah, that does tend to be a problem, and that's a very good question. It's a good thing to be thinking about during winter time, vitamin D.
Next question, absorption of vitamin and other essential minerals go down according to your age?
They can go down, and you know, the main thing that happens with age is also people's requirements change. So you know, they don't absorb as much because their digestive system and everything has been through more, and also they may require higher amounts because of age-related damage. So yes, so absorption goes down, but also needs increase. So for instance, as people age, their need for fluid needs increase, their protein needs increase because of age-related muscle loss, because of age-related changes in terms of skin permeability. People lose more fluids as they age and things like that. So yes, definitely, definitely.
Zinc a vital composition to WBC, which fights the infection. Is it advisable to take zinc supplement for old people?
So yes, zinc has shown to sort of help in terms of fighting infections, and hence it also aids with wound healing and things like that. But for someone old, as I discussed previously in the presentation, always good to just get a simple blood test before empirically starting zinc supplementation. If you really do want to start at the lowest dose, maybe 40 milligrams of zinc, and I would always like take it 1 or 2 days a week, right? But I still strongly encourage the person to get tested for zinc deficiency before they take zinc supplementation, because I worry about things like copper absorption. I worry about overdosing on the trace mineral, and I just worry about all of the other things that are added to supplement capsules and things like that. But you're right, there is some research showing that, you know, infection fighting abilities and immune response improving with zinc supplementation.
Next question, should a vegetarian woman in her mid-30s take protein supplement, or it's okay to take natural food?
So it depends on her need, right? If this is a person, like I know vegetarians who do not eat paneer, who do not eat tofu, who do not eat soybeans, who are, you know, who are very picky eaters. And so, you know, if you are someone like that, you may need to supplement, because you need to get the protein from somewhere, and the other forms of protein sources are just not going to give you enough. But if you are someone that's open to eating a lot of these things, then you're going to be fine. You don't need a supplement. And also, some vegetarians, they eat eggs. So egg is sort of an easy way to get some protein in. And Greek yogurt, that's also an easy way to get protein. Greek yogurt, just because of the way that it's strained, it tends to contain a higher amount of protein compared to regular yogurt. So that's another source. So if you are someone who's open to trying new foods, there are a lot of vegetarian options, and you don't really need to take a supplement. But if you're a picky eater, yes, you can take a supplement. Just be mindful of added sugars. A lot of protein supplements have added sugars, or they have artificial sweeteners, or they have a lot of thickeners and things like that. Be mindful of that. When you do supplement, think about the amount And remember, whenever you increase protein intake, you need to increase fluid intake. So don't just, start taking a protein supplement. Definitely cross-verify with a provider if that's a good choice and how much you need it.
Next question, what are the food restriction in acute inflammatory pseudo gout?
Oh, gout. So gout is another one. The first and foremost important thing with gout is cut the alcohol. Alcohol is one of the biggest sort of triggers for gout. The next thing is gonna be shellfish and like prawns and lobsters and things like that, and processed red meat. So generally, when you're eating lean cuts of red meat, it's fine. When you're eating processed forms of red meat, that can also trigger that gout. Overall, with gout, people also benefit from reducing sugar intake because sugar is sucrose, and sucrose is basically glucose plus fructose. And studies seem to show that higher intake of fructose is also increasing the chances of gout. So yeah, the alcohol, the processed red meat, being mindful of shellfish intake, and then definitely cutting out the sugar. As I said, it does not play a vital role in people's lives, except it tastes good and we enjoy it. We can get carbohydrates from potatoes, bananas, from a lot of things. Cut the sugar.
Any particular diet for hypo and hyperthyroidism?
Thyroid is a difficult one because hypo and hyper, again, completely opposite sort of situations. With hypothyroidism, it's usually iodine. Iodine intake is something that people want to be mindful of for hypothyroidism. That's also why there was like a global public health initiative. They started iodizing all the salt. It's in order to prevent hypothyroidism. But in general, with hyper, there's actually less manipulations that you can do. Overall, I think that it's very individual. They do say certain like avoid cruciferous vegetables, avoid soy, avoid dairy and things like that. And then people are like, what can I eat, right? So it's a trial and error process and very individual. So work with a provider and then try different elimination diets. And then thyroid function is also something that changes on a daily basis. So whenever you make a change, make it and then wait for a significant period of time while you make that change, and then check your blood work and then talk to your provider and be like, is this a significant difference? Is it getting better or worse? And that would be the approach that I would use rather than to just like throw the kitchen sink at it and try everything at once.
Next question, daily requirements of vitamin D.
So generally, if you're getting it from like sunlight, it's going to be about 600 international units a day. People who are taking supplements, you can take like 1,000 international units a day, and that's probably sufficient. For somebody who's super deficient in vitamin D, I might give them a higher dose, but in general, most people, don't. If you are at a normal level, you don't need more than 1,000 international units a day. Yeah.
I think last question.
Mm-hmm.
What are food restrictions for rheumatoid arthritis?
Mm-hmm.
Is there any particular diet process for rheumatoid arthritis?
So rheumatoid arthritis it's an autoimmune condition, and it's similar to like thyroid issues. These are very individual. And the thing with rheumatoid arthritis is a lot of times it is mostly managed through medication. This person's probably taking long-term medications if they do have rheumatoid arthritis. The main thing is to avoid other chronic illnesses. So similarly, be mindful of those allergy-causing foods. Be mindful of your overall alcohol and overall sugar intake, because these are things that compromise your immune system. But unfortunately, there is no one specific diet that actually helps for rheumatoid arthritis. There are people that are experimenting a little bit with like low carb diets and things like that, but nothing's quite conclusive for me to like recommended at this point for rheumatoid arthritis.
Last one question from the Facebook. Someone who has low cholesterol level, what should be he or she can eat in case of high uric acid at the same time?
Okay, so when the person says low cholesterol levels, I'm going to assume that they mean low HDL levels, like the high density lipoprotein, and not just like low overall cholesterol, because that's something that people want to have, right? Like people want to have low overall cholesterol levels. So I'm going to assume that they're talking about HDL levels. Foods that are going to help improve HDL levels are going to be things like olive oil, things like olives. If you are able to source avocado, you can eat salmon. That's something that you can have, which is not going to aggravate your elevated uric acid, and things like that. So there are a lot of foods that you can have that is not going to aggravate your uric acid and is going to help you produce higher HDL levels, and that's going to be your healthy fats, your monounsaturated and polyunsaturated fats, which you can eat to improve your HDL.
Thank you, ma'am. We have with us Dr. Joji John and Arindam Set, our secretary. John sir, please switch on your video. Thank you, sir. John sir, please say something.
Okay, sir. Good evening, all the participants, for the patient listening to the wonderful lecture about role of diet and nutrition for the recovery, speedy recovery of the injuries. And first of all, I thank Karthika ma'am accepting the invitation of the Bengal team and given a great lecture and enlightened us all about the diet and nutrition part for the injury recovery. And to all the team, the real hero, the Dr. Rishiraj, my IAPCEC from the East Zone, who is continuously making the educational events in the zone to put the education to reaching to all the students and the members of our family. And I will thank him for this relentless work he was doing for the zone. And once again, and thank the technical team of IAP, who is doing a wonderful job, hassle-free, to do all this virtual platform without any difficulties. And I will thank my president, Dr. Sanjay Sarkar, and Dr. Ruji Vashne ma'am. The concept which they've introduced to give a stage to take in the IAP platform, the webinars, so that all the students and the members will get benefit through this thing. And surely, I know that today's this wonderful evening, all have learned a lot, the importance of the diet and about the nutrition in our practice for our patients and the sports injuries and the healing. So it was a great lecture, and it is nice to join you all, because I know that for a long time, because the West Bengal family was inviting me, but somehow I can't able to join with different reasons. But this time it was I fortunate to be part of this event, and thank you so much to inviting me for this. Thank you so much.
Thank you, sir. Thank you. And now I would like to Arindam, please say something.
Thank you, madam, for such a wonderful and nice presentation. I think viewers learn a lot about the nutrition. Truly speaking, this is a very new concept and new topic to all the physiotherapists, so that it's an adjunct to our therapy that we can prescribe some of the nutrition diets and how the injury will be faster recovery. Thank you, madam. Once again, thank you very much. I'm really thankful to the IAP technical team for giving us such a nice support to us, and not least John sir, constantly motivating us to give do some better and new things for the IAP members and the students. Thank you, sir. Thank you, sir, for joining with us. And I am extended my thanks to for giving a constant support and the encouragement to do better for the our profession. Thank you all. Thank you all the viewers. Thank you, Kaushik.
Thank you. Thank you, ma'am. Over to you, Jasprit, ma'am. Jasprit, ma'am.
Thank you so much, ma'am, for this wonderful and informative session. I think to eat is necessity, but to eat intelligently is an art. Thank you so much for this wonderful session. Thank you, Dr. Kaushik De sir. Thank you, Dr. Arindam sir, Rishi sir, and Tanushri ma'am for organizing such wonderful webinars. Now extended my thanks to Dr. Sanjeev Jha sir and Ruchi ma'am for providing us this platform. Again, I request to all the participants, please like and subscribe IAP India YouTube channel and Facebook page. Thank you everyone and good night.
Thank you,
Thank
ma'am.
you.
Thank you.
Thank you. Thank you
Thank
for
you,
the
Karthika,
opportunity.
ma'am.
Thank you. Thank you so much. And I hope to see you guys in person soon. And everybody stay safe and have a wonderful Saturday night.
Thank you. Thank you, ma'am. Thank
See you.
you.
Bye. Bye.
Thank you, madam.
Bye.